Howdy folks, High Value DMD. This video is titled, Dental School Professors Will Frick You Up. If you're just tuning in, I am a dental student. I'm in my third year and I'll be moving on to my fourth year pretty soon. But let me earn your subscription. People ask for subscriptions. Let me earn yours. Don't just give it to me. Please let me earn it. Let me earn your like, comment, let me know what you think. It seems in dental school, a lot of the times when I want to do the right thing, I get penalized. I want to do things efficiently. I want to do things fast. I want to see as many patients as possible, do as much treatment as possible, both for my experience and for the patient's benefit, because they really need the help. But it seems like when you try to do too much, when you're doing too much and you stand out, that's when you get targeted. Dental school professors like to frick you up. They like to mess with you. They will find any little thing in your work to denigrate or to talk down to you about. It's a big hazing ritual, and there are some good dental school professors. There are. And I cherish those people, those good teachers. But the other ones that have no idea how to teach, that are narcissists, they think everything they do is correct in the only way, in the perfect way of doing things. I can't stand them. So there are rules in dental school. There are rules for a reason. You will do dentistry at a snail's pace. You will do dentistry 30 years in the past, essentially. You will be taking alginate impressions, not as much scanning, even though in my school we do have some scanning going on. But for dentures especially, you will be doing things the old way. You will be setting teeth by hand. There's all these little rules in dental school you have to follow. There is no room for creativity. There is no room for your own personality and your way of doing things. No, shut up and sit down. None of that. You will follow these rules and these procedures, no matter how antiquated they are, you will follow them exactly. Or you can try to do things your way and efficiently and good and try to do, like I said, do as much as possible. But you risk standing out. You risk maybe breaking a rule, stepping on a professor's toes that maybe they weren't that fast at dentistry, or maybe they weren't that talented at dentistry, or they weren't as good with people as you are. And they may get offended to see how good you're doing. And they will frick you up. For instance, I've got a professor that thinks he is God. He likes to do notes his way, and every other way is wrong. Let me tell you, folks, chart notes are subjective. What you need to do with a chart note is explain exactly what happened, what the patient said. If you gave anesthetic, tell me about the medications. Tell me about any medical history that changed, things like that. Write all of that down. But it doesn't matter what order you have it written down. It doesn't matter the style of verbiage. That is up to you. But I have a professor that thinks he's right, and he will keep me an hour to sit here and belabor the point of changing every little word. And I can tell you, he's actually contradicted himself several times. Several times. The point is, he wants to mess with me. He wants to sit there and waste my time and keep me at the school and mess with me. So I want everybody watching this video to expect that. A lot of times, dental school isn't about the patient. It's not about the patient. You may be wanting to do really good care for that patient. No, it's about the professor's ego. That's ultimately what dental school is about. What they want to do, no matter if it's for the patient or not. Heck, a patient could sit down for a crown prep that day that they have consented to, they want to do the procedure. But if you have a different doctor with you in the clinic that day, they may say, nope, we're not doing that, dismiss your patient. So basically, screw your patient's time and all that. Just forget it. Flush it down the toilet. Forget all the effort you did in making the treatment plan, setting up your room. Forget it. Just sit down and shut up and do as you're told. Oh, and by the way, pay $500,000 to come here. Dental school it can be frustrating. Professors can be frustrating. You've got to hang in there. You got to hang in there. You got to have very tough skin when dealing with these people. They're rich and they're narcissists. Most of them have been divorced 4, 5, 6 times or whatever it is. But I will say this, there is a reason they are teaching at a dental school. I'll talk more about that in another video. Thank you for watching. As always, stay hustling.